Immuno-Oncology has really changed the outcome in relapsed refractory ALL. As I mentioned earlier, uh, patients who are progressing after induction chemotherapy, having relapse after or refractory to induction chemotherapy, their outcome tends to be poorer. And with all those conventional chemotherapy regimens, with successive chemotherapy courses, the outcome tends to diminishes. And with these novel agents, more patients are achieving remission after being refractory or progressing after conventional chemotherapy, and more patients are able to receive allogeneic stem cell transplant for sustainability of remission. As we all know that relapsed refractory ALL, the only curative option till date is allogeneic stem cell transplant. And there's always been a dilemma how to successfully bridge these relapsed refractory ALL patients to allogeneic transplant to improve long-term outcome. We had chemotherapy in the past, and small proportion of patients were able to go into allogeneic transplant, and significant proportion of patients tends to have succumb to disease and toxicities of therapy. With these novel agents, as I mentioned, Blinatumomab, which is a BiTE CD3 CD19, which engages T cell to attack CD19 positive leukemic cell, as well as antibody drug conjugate like Inotuzumab Ozogamicin, which binds to CD22 antigen leukemic cells and led the Ozogamicin, which is a derivative of calcimicin, to kill leukemic cells, have significantly improved outcome of these group of patients, and more patients are able to bridge to allogeneic transplant to improve long-term outcome. And now there are studies ongoing. At this point in time, these novel agents are approved in relapsed refractory settings, but there are studies in early incorporation of these novel agents to improve outcome further with less toxicity and more tolerability.